Paralysis is the loss of muscle function in part of your body. It happens when something goes wrong with the way messages pass between your brain and muscles. Paralysis can be complete or partial. It can occur on one or both sides of your body. It can also occur in just one area, or it can be widespread. Paralysis of the lower half of your body, including both legs, is called paraplegia. Paralysis of the arms and legs is quadriplegia. What causes paralysis? Paralysis is most often caused by strokes, usually from a blocked artery in your neck or brain. It also can be caused by damage to your brain or spinal cord, like what can happen in a car accident or sports injury. What are the 4 types of paralysis? Monoplegia, hemiplegia, paraplegia, and quadriplegia. Paralysis is the inability to move a part of the body and comes in different types. One may become paralyzed after a spinal cord injury, SCI, or trauma. There are 4 types of paralysis. What are signs of paralysis? Symptoms: numbness or pain in the affected muscles, muscle weakness, visible signs of muscle loss, muscle atrophy, stiffness, involuntary spasms or twitches. Who is at risk of paralysis? There can be many causes for paralysis, but is often caused by strokes, usually from a blocked artery in your neck or brain. Some other common causes are nerve injury, poliomyelitis, multiple sclerosis, cerebral palsy, Parkinson's disease, spina bifida, peripheral neuropathy, ALS, botulism, and Guillain-Barré syndrome. Can stress cause paralysis? Some individuals are more susceptible to periods of temporary paralysis after exposure to certain triggers, such as stress, trauma, or anxiety. The periodic paralysis can result in severe muscle weakness and the partial or complete inability to move parts of the body. Is paralysis permanent? Paralysis is the loss of the ability to move some or all of the body. Depending on the cause, it may be temporary or permanent. Call 999 if you or someone else has paralysis that begins suddenly, begins after a serious injury, or causes problems with speech, breathing, or swallowing. Paralysis can manifest in various types, depending on the location and extent of the damage to the nervous system. Here are some common types of paralysis. Monoplegia. This type of paralysis affects only one limb, such as an arm or a leg. It's often caused by localized nerve damage or injury to a specific area of the body. Hemiplegia. Hemiplegia refers to paralysis on one side of the body, affecting both the arm and leg on that side. It's typically associated with conditions like stroke or traumatic brain injury. Paraplegia. Paraplegia involves paralysis of the lower half of the body, including both legs and possibly the lower trunk. It usually results from spinal cord injuries or diseases affecting the lower spinal cord segments. Quadriplegia. Tetraplegia. Quadriplegia affects all 4 limbs as well as the trunk and pelvic organs. It occurs due to injury or damage to the cervical spinal cord, typically higher up in the neck region. Conditions like severe spinal cord trauma or certain neurological disorders can lead to quadriplegia. Diplegia. Diplegia is characterized by paralysis affecting corresponding parts on both sides of the body. It often involves the lower limbs more severely than the upper limbs, and can be seen in conditions like cerebral palsy. Paresis. Paresis refers to partial paralysis or weakness of a muscle or muscle group. It's less severe than complete paralysis and may result in reduced muscle strength and control. How to diagnose paralysis patients? Diagnosing paralysis in patients involves a comprehensive evaluation by healthcare professionals, typically including the following steps: medical history, gathering information about the patient's medical history, including any previous injuries, illnesses, surgeries, or neurological conditions, can provide valuable insights into the potential causes of paralysis. Physical examination. A thorough physical examination is conducted to assess muscle strength, sensation, reflexes, and coordination. The examination may involve testing the patient's ability to move different body parts voluntarily and evaluating muscle tone and function. Neurological assessment. Neurological tests are performed to assess the functioning of the nervous system, including the brain, spinal cord, and peripheral nerves. This may include tests of sensory perception, such as touch, pain, and temperature, as well as tests of motor function and coordination. Imaging studies. Imaging tests, such as X-rays, CT scans, or MRI scans, may be ordered to visualize the structure of the brain, spinal cord, or other relevant areas. These tests can help identify any abnormalities, such as tumors, fractures, or herniated discs, that may be causing or contributing to paralysis. Electrophysiologic tests. Electrophysiologic tests, such as electromyography (EMG) or nerve conduction studies, may be performed to assess the electrical activity of muscles and nerves. These tests can help determine the extent and location of nerve damage or dysfunction. Laboratory tests. Blood tests or other laboratory tests may be ordered to screen for underlying medical conditions, such as infections, autoimmune disorders, or metabolic abnormalities that may be associated with paralysis. Specialized evaluations. Depending on the suspected cause of paralysis, additional specialized evaluations or consultations may be necessary. For example, if a stroke is suspected, the patient may undergo imaging studies of the brain and blood vessels, as well as cardiovascular assessments. Thank you for watched my video. Please subscribe my channel.